I get asked frequently in clinic and in my DMs and in comments about what is the difference between Botox and dermal fillers. Today, I'm going to dive deep into how Botox works and how it is so different than dermal fillers. I will be out and I'll be with a bunch of friends, and all of a sudden someone will make a comment, oh, look at her Botox, or look at that Botox. But it's really not Botox, it's dermal fillers, because they're referring to somebody's lips that looks like a sausage. So I'm here today to actually give you education on what Botox is and what is a dermal filler. My name is Chantal Ward, and I'm a registered nurse specializing in medical aesthetics, and I'm here today to give you the information you need so that you can make sound decisions for yourself in your aesthetic anti-aging journey. Botox. What is Botox? Botox is a neuromodulator or a botulinum toxin A. This is derived from a bacterium called Colostrum botulinum. It's a big word. There's lots of big words in this scientific, but I'm going to try to keep it very simple. In cosmetic medicine, it is used in a safe, low dose to basically temporarily relax muscles from moving. It targets the particular neuron or the neuron receptors between the muscle fibers from twitching or moving. How I describe it is that it's blocking the signal. So our brain is going to say, look angry, and you're going to get a neurological impulse or a message from your brain to this group of muscles to frown. And what happens is there's a chemical called acetylcholine that is released in the muscle fibers. And if you can envision in the muscle fibers, in the muscle, like let's say your biceps, you've got hundreds of thousands of little muscle fibers that are all twitching and moving at the same time. So that acetylcholine is basically binding to the end of those muscle fibers to stop them from communicating. So when you try to look angry, I'm looking angry right now. Can you see that? The muscles are interrupted. They're not going to twitch. Okay. So if I really look angry, then there's some movement there and they are communicating through that neuron receptor. So Botox, Xeomin, Dysport, all of those neuromodulators or neurotoxins are acting on the same nerve bundle or the muscle bundle fibers to stop them from communicating. We never talk about paralyzing, okay? It is not going to paralyze you. It just stops that muscle from twitching. What happens? So if we do your treatment, we're going to inject you to have a minimal amount of dosaging, or what we call Botox units or neuromodulator units, to get the desired result so that you look natural and not overdone. My personal preference is that I like to have movement. I don't like that frozen look, but it's imperative that I don't stop certain muscles from moving because they are important in keeping, for example, my brows up. As we age, dosage and where we treat changes. If I step back and people get all freaked out about, oh, it's botulinum toxin. Well, to give you an example in the aesthetic practice of using neuromodulators, let's say for anti-aging, in the forehead, in the glabella, around the eyes on the crow's feet, we may use anywhere between 40 units and 50 units. Now, that's not 40 or 50 needle jabs or needle pokes. It's basically we will add certain number of units in an area that total that 40 to 50 units. Where I'm going with this is that these neuromodulators, some of these manufacturers or pharmaceutical companies are also in the medical field. They help patients with dystonia, muscle constrictions. So dystonia is when a muscle contracts so much that they can't lift their head forward or the muscles are contracting inward. So for those neurological patients, the neurological doctor or injector will actually inject anywhere between 3,000 and 4,000 units in managing these patients to give them a better quality of life. So in the aesthetic field, for example, forehead around the eyes is 40 to 50 versus in the medical world, they would do anywhere between 3,000 and 4,000 units. There is also a big utilization of neuromodulators, specifically Botox, in Canada, in the US, for masseters, for TMJ, people who suffer from migraines. So there are a number of different applications of neuromodulators other than just the aesthetic practice, but they work on the same principle of interrupting the neuron receptors. It's not just used for fine lines and wrinkles. We can treat TMJ, masseter or jaw pain. We can use it for excessive sweating. We can use it in the medical world. For example, we can use it for gummy smiles or asymmetric smiles. There's so many clinical indications that work exactly the same way as what we're doing in the aesthetic market. Now let's talk about dermal fillers. So dermal fillers are made up of manufactured sterile hyaluronic acid. So our body has a lot of hyaluronic acid or HAs naturally in it. And what the manufacturers of dermal fillers do is they take that hyaluronic acid and they manufacture it or put it through a process where it becomes a little bit thicker. It's still in its natural state, but we're making it either more dense or more liquidy. So depending on what we're trying to accomplish, that hyaluronic chain has been changed to have more structure or less structure. Dermal fillers are either used for structural replenishment or structural change or replenishing volume loss. Okay, let's talk about volume loss first. So in areas where you've lost volume, so as we age, we have these wonderful fat pads that sit mid-cheek, temple areas, around the mouth. These are areas that we can use dermal fillers to actually revolumize that volume that we've lost. Now, I've talked about fillers for men that, for example, if a man has lost structure to the jawline, we can actually use dermal fillers to give structure. So this notion or understanding that I'm going to look like I've had work done, I'm going to look puffy and a balloon-like, it's incorrect. It's really in the hands of the injector who is strategic and educated and understands the aging face will place the product in the right zone or right region of the face for the best desired result. Does that make sense? So when we use it, we could use it to restore cheek or volume loss. We can enhance lips. So, women who get lip fillers, there are a lot of women who get lip fillers. You would never know that they've got it because it's more to enhance hydration than to give volumization. Some women like that big volume look, but really there's a lot of people that are walking around that you would never know have dermal fillers in their face. Under the eyes. So if someone's lost volume under their eyes and their tear troughs, their jawline, their reshaping of their chin, we could even do it where an aged hand, if someone's lost a lot of volume in their hands, we can do dermal fillers in their hands as well. When we look at dermal fillers, we see an immediate effect of reshaping or volumization. So right now, I want to show you the difference between a Botox, what it looks like, and a dermal filler. I'm going to take some dermal filler here and I'm going to make a little pyramid of the dermal filler. And typically, if I was going to do, let's say, revolumization or structure to get rid of some of these nasolabial folds, I would actually inject the product deep to periosteum, and I would actually pillar it up underneath the ligament so it stays in place. You can see how it doesn't lose its shape. So in essence, what's happening, it's pushing up the tissue so that if I place it here and we've got this hollowness, it's actually pushing up the tissue to give it structure. Now, the difference with Botox is that when it's injected into the muscle, we know that it interrupts the neuron receptors between the nerve fibers. You can see how, you can see how it's a little bit of watery, okay? And I'm actually putting it in, you can see the puddle. Whereas the filler here has been sitting and it's still maintaining its shape. I can actually move it around. Now, dermal fillers, I'm saying move it around, I'm moving it around here, but dermal fillers, when they're placed in the right tissue at the right depth, do not move, okay? Because a well-educated and a well-trained injector will know exactly at what plane in the tissue that they should be injecting that dermal filler. With dermal fillers, the results are pretty much right away. Now, after the injection, you will get a little bit of inflammation and filling because of the needle pokes, but that inflammation settles down and the tissue will be still kept up in its upright position wherever it was injected. Whereas with Botox, Nuceiva, Dysport, Xeomin, it actually takes 2 weeks to see the maximum result. So Botox stops the muscles from moving and contracting. A dermal filler, and there's a whole bunch of them out on the market, I'm not going to name them all, actually deal with restoration of volume loss. It can give you structure. It could also do some regenerative collagen stimulation as well. So there is a big difference between Botox and a dermal filler. The two combined can be a powerful duo, because sometimes if you have muscles that are pulling down or contracting, it gives you that illusion that you've lost volume. So, or you have lost volume and you want to actually deal with some of these muscles that give you that sad face and give it some volume back. So doing the two Botox and fillers on the same visit is also an acceptable treatment plan. Understanding the distinct roles between the two, understanding that Botox doesn't make people look crazy and dermal fillers don't make people look crazy. Basically, it's the injectors that make people look crazy. So you want to make sure that you're going to the right person who's well-trained, who keeps current, who continually goes back to education and keeps current. That I can't stress that enough, that someone who is, taking a weekend course and not doing regular education and keeping their skills is, in my opinion, not the right person to go to. Understanding the distinct roles between these two, you need to trust your healthcare provider or your aesthetic provider that they're going to give you the best treatment plan that's going to keep you looking natural and fresh and not looking overdone. I want to thank you again for watching this video. If you have any questions, put it in the comments below. Subscribe, give me a thumbs up, and we'll see you next time.